My name is Dr. Harry Waters, and I am a board-certified physician. I'm the medical director of today's Women's Health Specialists and Advanced Men's Performance Centers. When I first started using Genesite, of course, I did my research on what their studies showed and what some of the outside studies showed about their application in the product. My philosophy about practicing medicine was similar to what Genesite's was. Why have a broad brush that takes everybody and uses the same drug for everybody, when really we have the technology now to personalize that and do it right the first time. Genesite is a tool. It's a tool that's very easy to use, that has no negative side effects. There's no downside to using Genesite testing. It's really a straightforward explanation to the patient. The fact that it's non-invasive, the fact that it takes less than a minute or two to perform the test always is very helpful. And if they found out that their insurance covered it, or that there was some form of an opportunity to get a rebate on the testing, they were absolutely in favor of it. And it's certainly not a big investment in time to read the genetic report that Genesite sends out, because it's very simple and easy to read, and it doesn't take a lot of time to interpret it. Any of our clinicians that are practicing out there today can really look at the Genesite test with a great degree of confidence and say, I understand what it's telling me. And they don't have to do a lot of interpretation of that result. It's pretty black and white when it comes to the reporting. I've had a patient that came in who was depressed, for example. She came in and she had gone to several different physicians, including a psychiatrist and psychologists, and had been recommended numerous medications. Each one had a side effect to her, each one. As soon as I put the patient on a different medication that was appropriate for her based upon Genesite testing, the side effects went away. I know what genetically that patient is going to metabolize the most appropriately. And if I can do that the first time, why would I want to do anything else? Genesite eliminates excessive costs because we're not going to put patients on the wrong medication. And normally we want to see a medication, for example, something like an antidepressant or an antipsychotic. Normally we'll say be on it for a month or 6 weeks before we see what the results are. And in the past, when there wasn't Genesite testing available, it may have been 6 weeks of no good therapy. And now we have the ability to say, we're going to get good therapy in 3 weeks or a month. Frankly, the way it was practiced before, it was a dartboard approach. Here's a dartboard, here's the disease, and we're throwing darts at it to see if we can figure out where the bullseye is. And now the bullseye is Genesite. The bullseye is where we have clinical and scientific proof that there's the bullseye. And so we can stop throwing darts at the periphery and target in on the center of the target and get a bullseye when we use the right testing.